Hi everyone. Welcome back. We had a pretty short break since the last session, Future of Community Care. Now we will begin the session, Make a Difference in Community Care, Residential-Based Care with Ren Ci Hospital. Ren Ci Hospital is one of the largest non-profit healthcare institutions in Singapore with a focus on multi-services community care, and they will be sharing on working within the community hospital and nursing homes. Before we begin, if you have any questions for our speakers, please feel free to type your questions into the Q&A box. If you would like to direct your question to a specific speaker, please kindly indicate it in your question. Lastly, if you see questions that you're interested in being answered, please upvote the questions. We will have time for Q&A at the end of the session. Now, I'd like to hand over the time to the following speakers from Ren Ci Hospital. Nor Yasmin Hannah, Director of HR, and Chong Pei Lan, Director of Community Engagement. Yasmin and Pei Lan, please.
Hi everyone who's watching online now. Thank you for joining us today. I am Yasmin, the HR Director in Ren Ci.
And I'm Pei Lan, Director of Community Engagement, and we promise you a most informative session as we spend the next hour or so introducing you to exciting career opportunities in nursing and rehab therapy within Ren Ci Hospital.
We will have a live Q&A right after all the sharing by our fellow colleagues. So type in your questions in the comments section and we will address all your queries in due time.
So let's get right down to business. First up, we will do a quick introduction to Ren Ci Hospital. Type into the screen if you have heard of Ren Ci Hospital before.
Okay, so many of you may have heard of Ren Ci Hospital before, but not many know that we were already established way back in 1994.
Yes, Ren Ci Hospital was established in 1994, which will make us 27 years old this year. Now, as a healthcare non-profit institution that was set out to cater to the old and the needy, our vision of providing holistic healthcare with loving kindness and compassion remains relevant to this day. And our mission is to continue providing inclusive healthcare for quality and meaningful living for our patients, nursing home residents, by working closely with partners in the community.
It is also important for us to share our core values. They help to shape the culture and reflect what we value as an organization.
Right.
So we use the acronym TOCARE, TOCARE, to explain our core values. T stands for teamwork, work as a team, earning trust and helping each other to achieve our goals. O is for open-mindedness. We listen to new ideas and feedback and incorporate them in the way we work. C is for compassion. And if you guys don't know, Ren Ci stands for compassion. Right, so we touch lives by showing care and concern for individuals with whom we serve and work. A is for alliance. That is fostering collaborative partnership with stakeholders in the community. R is for respect. We recognize every individual as a unique person of worth and dignity. We value and appreciate diversity. And last but not least, E is for excellence. We continuously improve, innovate, and embrace changes to be the leader in community care.
That was an excellent summary of our Ren Ci core values. And now some quick numbers to continue our introduction to Ren Ci. At Ren Ci, we have 900 over staff working across 3 sites. Our community hospital is sited right next to Tan Tock Seng Hospital, and we have 2 nursing homes, one in Ang Mo Kio and the other in Bukit Batok. We also have 3 senior care centers that are actually co-located at the 3 sites that I mentioned earlier. As a non-profit healthcare institution, we also work very closely with volunteers. Together with the volunteers, we have served a total of 2,900 patients across the 3 sites the whole of last year.
Oh wow. Hey Pei Lan, why are the number of people we serve not any higher?
That's a very good question, Yasmin. So one defining features that differentiates us between us working in the community care sectors and that in the acute setting is that our patient remains longer with us.
I see. Hey, I really think organization in community care setting like Ren Ci can offer a diverse and rewarding experience for would-be healthcare workers.
That's right.
With our family-like culture, in Ren Ci, we support our employees to gain deeper insights and learning opportunities in the role that they work in. As a fresh graduate, there are plenty of opportunities for you to learn from your seniors. You'll be given diverse work exposure in the different community care setting. You can choose to work in a community hospital and in nursing homes, and the opportunity to work with multidisciplinary team. As an organization, we do have our fair share of trailblazers, right? So our chief nurse, Madam Sim Teck May, was conferred the highest accolade in nursing. She was conferred the President Award for Nurses in 2019. Wow. Okay, so our head of psychosocial services, Miss Bridget Monica Das, was conferred the Outstanding Social Worker Award in 2020. For this is to recognize her significant contribution in the area of medical social work.
Truly inspiring. Now, their success didn't come overnight, but the community care setting can and do offer opportunities to match your aspiration in life.
Yeah, okay, totally. This sector has in recent years been consistently been referred to as the sunrise industry.
Sunrise versus sunset industry. So what's the difference?
Oh, there's a lot of different, definitely. As a fresh grad, you want to be in an organization in the sunrise industry.
Okay.
With the increasing rate of silver population in Singapore, the community care sector is showing promise of a rapid boom, right? So in fact, just because we focus on the elderly does not mean things are moving at a snail pace, right? It is an exciting sector and a place to work in, especially in Ren Ci.
Right.
Okay, so take for example our nursing home design. Ren Ci current 2 nursing homes are different in design because we are always improving, right? In fact, the upcoming 3rd nursing home for us in Woodlands will yet feature other exciting developments. Okay, enough said. We shared quite a fair bit already.
Yes, we did.
So we would like to share with you our current nursing home in Ang Mo Kio to give you a better idea of the working environment here. Here's a sneak peek of the video. Enjoy the video, guys.
Let's watch. Yasmin, do you get a sense of family after viewing the previous video?
Hey, of course, Pelan. The family spirit is always there in the organization. We live by our core values. And that builds the foundation of the organization on a daily basis,
That's right.
So the first picture you can see, right, is actually a picture of Ren Ci family. That was taken in the recent Ang Mo Kio nursing home opening in 2019. We don't only have our senior management staff gracing the event, but we also have them as part of the people on the ground working together alongside with staff, so it was a very successful event. So you can see all our happy faces on the picture.
And we all look good in green.
Awesome, right? So green is the new black, guys. Okay, so the next picture you see is our staff appreciation dinner. So it's not another day at work where we come in uniform. We can see all our staff dressed up for the event in a very professional manner. So they really come up like Cleopatra, like any other makeup superstars.
Again, awesome costume.
Yeah, so we always take opportunity to party, Pelan. So the next picture you see is our year-end party. It's an annual event, all right? So we always have a special theme for events, and for that particular picture, it's what is that? Yeah.
I remember this one. The Mad Hatter's party. It was so fun. Yeah.
So if you look close enough, you could catch myself and Pelan dressing up for the event.
Yes.
All right. So any other opportunities, even festivities, Chinese New Year.
Yes.
You know, we have the senior management staff performing, and we even have a lion dance troupe for the event. Oh, isn't it awesome? Where else can you get all that, guys? Okay. So coming back to seriousness, right? We need to keep our health in check. So as an organization, we do organize a lot of sports activity for our staff. You see in the next picture is many of us completing our Marina run. That was in 2019, you know. So we look very tired, but we were all very happy because we get the opportunity to run together, bond with our colleagues.
I hardly see you looking so sweaty.
Okay, right. So there are also inter-department sports competition. And only recently, because of the lockdown and circuit breaker, we did inter-department TikTok competition. Isn't it awesome? Right. So last but not least, I thought we share with our audience that we do leverage on our volunteers, you know, on doing up our annual carnival fundraising event. So it's very carnival-like. It's so fun. It's like our own Dover Street Market event, right? It's all for good cause and to raise funds. Maybe over to you, Pelan.
Yeah, so I hope that we have actually given you a good insight into what Ren Ci Hospital is about. At the same time, the fun part of what life in Ren Ci Hospital can be. Now we're going to move on to the next session where we're going to invite our colleagues from nursing and rehab therapy to join us to the show and to share with you what exactly professional delight and joy they actually derive from their job. First up is going to be Betty from nursing, who's going to join us on the show.
See you later.
Thank you, Betty, for joining us on the show. Why don't I invite you to introduce yourself to the audience and what you do in Ren Ci?
Hi, I'm Betty. I'm the Assistant Director of Nursing, and I'm working in Ren Ci Community Hospital.
So, Betty, I think the very first question we're going to ask is how long have you been a nurse?
Oh, I've been a nurse for 28 years.
28 years. What makes you decide to embark on the nursing journey in the first place?
I wanted to all the time to become a nurse. Especially nursing cannot be learned by just reading from books and academics. You have to be trained and skilled as a nurse. And I know that in nursing, I would be able to help people, and not only people, but my own family members. That's why I want to become a nurse.
Okay, so you have been a nurse for 28 years old. For 28 years, sorry. So why the community care setting right now?
The reason why I think I want to come to community nursing is because we know that community nursing is a budding industry. You know that this is a new area whereby we have moved away from our previous nursing concept, where we just want to admit all our patients into acute settings and get them well there. Now we want to keep everybody well in the community setting. And not only that, we want them to live well to the end, that they will live with dignity and respect. So we have shifted our concept now to community. So you should be in the community nursing, because that's the new era for you. It's a blooming and budding area for nursing.
Yeah, so Betty talked about budding industry, and then you will remember that Yasmin has earlier referred to the community care setting as the sunrise industry. Right, so as a community care nurse, what would be one of the most memorable experience for you so far?
I think one of the most memorable experience for me is when I was deployed to Lee Amoy, which is the first COVID positive for nursing home. At that juncture, after being deployed, I led a new entire team to nurse the residents that is there. Why was it most memorable? Is because the whole entire team that was previously in Lee Amoy, the nursing home, they were all under quarantine. And caring for these residents remaining there, moving them from positive to negative and out of COVID, was really rewarding. There were many good experiences that I have there. Number one, I realized that we have got a lot of community support. The nurses there actually all knew. The moment we know that it's positive for Lia Moy, we send and deploy lots of people into here. So we have got community hospital from everywhere else, deploying manpower to support Lia Moy, even nursing homes. And then we've got AIC also supporting. So community nursing is not about yourself. You've got people supporting you. And that's a very tremendous experience for me, because I've never been so well supported in my life, except when I'm working in a community, to realize that, nursing is not just about yourself now. It is about every other person, all other partners.
I think that's truly inspiring. Within the community care setting, I guess you see a lot of teamwork, you see a lot of camaraderie, you see a lot of people supporting one another. I think that's really, one of the greatest joy in working life, where you actually not just have colleagues, you actually have friends here.
Yes.
Betty, what would be the one advice that you have for our audience right now out there still wondering whether nursing is actually a viable career choice for them?
If you're a person who likes engaging people, if you like elderly, join community nursing. It has got a lot of arena for you and space for you to grow and groom yourself. And there's a lot of opportunities out there, for you to decide on how you want to move on. For example, in community nursing, if you like dementia, you can be a dementia nurse. If you like wound care, you can be a wound nurse and progress specialization in that area. If you can do palliative nursing, if not just basic community nursing also can. So it's a lot of expansion role for yourself to grow, most importantly, yourself and your brain academically.
Wow. So those are all the options that you can have in nursing. Next up, I'm going to invite Charmaine from the rehab team to actually share with you all the opportunities there are in the therapy. Thank you, Charmaine, for joining us today. Why don't we start off by inviting you to tell our audience how old you are this year?
I'm 27 years old this year.
And you are an occupational therapist with Ren Ci for how long already?
I started working about 4 years ago, so yes, 4 years.
So occupational therapist is also OT for short. Maybe you can actually tell our audience, what does an OT do on a daily basis?
So an occupational therapist is involved in the rehabilitation of patients with long-term illnesses and serious conditions to try to help them achieve their independence, or as much as they can improve their quality of life. So we work with both patients and their families.
So at a stage of the point in your life, what makes you decide to become an OT?
So I didn't expect to be an occupational therapist when I was younger, but after hearing stories that my mother had, my mother was an ex-nurse, so she shared a lot of stories with me regarding her interactions with patients, and that really inspired me to join the healthcare profession in the future.
Okay.
So it was only after the A-levels that I heard how therapy was able to help patients regain their function, and I thought that was quite cool, so I decided to join the course.
Cool. Okay, so after your A-level, what are the education process that you have to take to become an OT?
So I started my training as an occupational therapist. I joined the Nanyang Polytechnic to get the 3-year diploma course. And after that, I joined Ren Ci, worked for 2 years, and I was offered the Ren Ci training sponsorship. And it was after that with the sponsorship, I joined the Singapore Institute of Technology for my 1-year degree conversion program.
Okay, how does Ren Ci training sponsorship actually help you, in your career growth? How does taking it on actually help you?
Okay. So, deciding to study after working was a bit of a decision, because I had to consider the financial aspects of it, the cost, the loss of income. So having this sponsorship really helped to make the decision a bit easier, because I didn't really have to worry about the financial aspects. So that really took off a burden.
Yeah, so the Ren Ci training sponsorship actually gives you a salary while you continue to learn and to improve yourself, right?
Yeah.
So that's great. So after you finish your 1-year degree conversion course, what was the opportunity that were available to you at Ren Ci? How do you take your skills further?
So after the conversion course, I was involved in the multidisciplinary team that was part of the team that was helping to develop the palliative care service in Ren Ci. So working as a team, we decided to develop a program that that was holistic to best support the palliative patients and their caregivers.
Maybe you can also, describe to the patient, to our audience, what exactly are the group of palliative patients? Who are they?
So palliative patient refers to patients that are towards the end of their life. So what we try to do is to help them maintain their function, improve their quality of life, and also to support the families as much as we can.
So there's a lot of satisfaction, job satisfaction when you're able to comfort the group of people, the palliative patients.
Yes.
Okay. So what are your hopes and aspirations, as you continue your career growth in Ren Ci?
So my hopes and goals would be to be able to push myself further so that I can provide the best care that I can for my patients and their families. And also from what I learned, the skills, the knowledge, I hope to share this with my colleagues, my juniors, so that we can all grow together as a profession.
Okay, maybe I can actually invite one more last time, to actually give our audience what would be that one advice to them, whether they are deciding, whether OT is actually a career choice for them.
I think the only advice I can give right now is to not be afraid, follow your passion. If you do feel like you have a passion in helping others, try, and try. So don't be afraid, you're young. Go ahead and explore. Yep.
Okay, thank you so much, Charmaine.
Thank you.
Next, I'm going to invite Charmaine's colleague, Tian Rong, who is a PT or physiotherapist, to come on and share with us why he decided to be a PT and not OT. Hello, Tian Rong. So welcome and thanks for joining me. So you will recall from the earlier session that I had with Charmaine, I'm going to start by inviting you to tell the audience how old you are this year.
Hello everyone, I'm Tian Rong. I'm 27 years old. I've been working as a physiotherapist for 2 years now.
Okay, so physiotherapist or PT for short.
Yes.
Now, so maybe you can also tell our audience, what does a PT do and how does it differ from an OT job?
So a physiotherapist works very closely with the patients to improve on their strength, their balance, their endurance, to get them to the functional status that they were before they were admitted to the hospital. The occupational therapist actually works a lot more on the patient's activity of daily living and finding meaningful activities for the patients. And for the physiotherapists, we work very closely with them to get them to that level of function so that they have the opportunity to do those activities.
Okay, so PT and OT, they work very closely together, two very important members of the rehab team, right?
Yes.
So what was your education process and journey like? Is it like Charmaine, you started off in the poly?
Yes, so actually just like Charmaine, I was in Nanyang Polytechnic for 3 years studying the physiotherapy course. After graduating, I went to work at Ren Ci first to gain experience and knowledge and to save up for school to go to the SIT, Singapore Institute of Technology, like Charmaine, to pay off the financial cost of going for the degree.
So you were also a recipient of the Ren Ci training sponsorship.
Yes.
So that was helpful as well, right?
Yes. So fortunately for me, while working at Ren Ci, I was offered the 1 year sponsorship course, 1 year sponsorship training, 1 year.
The training sponsorship.
Yeah.
Okay.
I was offered the 1 year training sponsorship from Ren Ci, so I didn't have to worry about the financial burden that comes with this course.
That will be helpful. So why don't we go back a little bit a few years earlier and maybe share with the audience what makes you decide at that point to go into rehab to become a PT? Yeah.
So honestly, after A levels, I was quite uninspired, quite burnt out actually after studying for the A levels, and I didn't really know what I wanted to do. So, but I knew that I didn't want a desk-bound job from my experience in national service.
Okay.
So that really taught me that that's not the job and life that I really want. But during that time in national service in NS, I realized that a lot of my subordinates in camp, they all went for physiotherapy for their injuries. That made me really curious about the course and the career in general. And at that time, I was very into sports and exercising. So it really tied in with my goals in life during that time.
Okay.
And I went to read up more about the course and find out about what actually a physiotherapist does, and that really interested me that really brought me to where I am today, where I signed up for the course and now I'm here.
Yeah, that's right. So you went for your diploma, and then after that you have that conversion degree. So once you're back in Ren Ci, what kind of career opportunities and growth were there available in the organization for you?
So I actually have participated and helped in a dementia exercise program on coming back. So this program helps to the objective of it is to really work with the occupational therapists as well as the family members of the patients to really help them to understand the patient's conditions more and to help them to better engage with the patients with dementia as well as to keep them physically active.
Okay. So what are your hopes and aspiration moving forward?
So I really hope that I can continue to improve on my clinical studies, and if I have the opportunity, given a few, given with the knowledge that I have, I hope to be able to mentor and supervise new and young physiotherapy students and physiotherapists, and to be able to guide them through this process as well.
Yeah, just like how you've been guided while you're at Ren Ci, right? Okay, so maybe actually for the audience out there, what would be the piece of advice for them, now that they're at the junction of their road, deciding whether or not rehab therapy is actually for them?
So I would advise the people watching and who are interested in the course really look up on the course and really to read up on what is physiotherapy, the different allied health professions as well. Don't be afraid to go for on-job shadowing to really gain the experience. Ask the people in the career about how are they doing in this job, how do they like it, and then really figure it out for yourself if this is the course for you.
Yep, and if you are ever in doubt and you need guidance and mentorship, you can always write to Tian Rong at Ren Ci Hospital and then seek his input on this. So thank you very much, Tian Rong, and thank you all for the rest of the colleagues who have actually shared. You've actually heard 3 sharing so far. The next segment is actually the live Q&A where you can actually send in your question to us. But before we answer those questions, just keep them coming. We have already preempted, the top popular questions, and we have actually video answers for you. Let's watch. For new graduates joining Ren Ci, they will need to go through 1 year of clinical supervision under the Allied Health Professional Council requirement. All staff in Ren Ci will have the opportunity to be working across different settings, be it either in a community hospital, nursing home, chronic sick unit, or a senior care center within the first 2 to 3 years of joining. And within each setting, staff will get to learn, develop, and apply different skill sets. So for example, in terms of goal setting, discharge, or care planning for patients. Usually pre-COVID, we do our rotations every 6 monthly. But of course, staff may choose to remain in a certain setting should they need to develop further in a particular area, and also depending on their learning needs. Staff may also indicate which area of practice they are keen to focus on and develop in subsequently. In terms of opportunities for learning, we do organize weekly services for our therapists, discussions with the supervisors, peers, and also send them for external courses. For those staff who are actually keen to go for further studies in terms of the post-grad learning, we do support them in that manner as well.
So there are really 3 things that we are looking out for in our potential sponsorship candidates. So first and foremost, we hope that you have the passion to serve in the community care and the ILTC sector. So, with our current climate, our aging population, there are a lot of changes that are happening in this sector, a lot of improvements, a lot of enhancements, a lot of projects. So if you feel excited and you want to contribute to better improving the lives of the elderly, and their families, I think this is a place that you'll want to be at. Now second, of course, it will be the alignment to our organization's core values, our care philosophy, our mission and our vision. So we would like to invite you to take a look at our website, and if you see yourself in what we do, if you like what you see, I think this is also the place that you want to be at. Finally, of course, as a sponsored candidate, we hope that you will have the commitment to your studies and the desire to grow with us as you journey along in the career.
Okay, thank you, speakers, for your sharing from Ren Ci Hospital. So we will now take some questions from the audience. Okay, can I invite the speakers to come on screen, please? Okay, hi, Yasmin and Dr. Betty and Ka Ing. Okay, so I will start off with the first question. So this question is for Dr. Betty Kong. Can you share what is the career progression for nurses in Ren Ci Hospital?
Nurses in Ren Ci has got many opportunities to grow themselves in their career. So firstly, if you started off as a staff nurse, you can then grow yourself to become more senior, so become a senior staff nurse. And after then onwards, you can decide which career path you want. If you like leadership a lot, you like administrative, you can go the nurse manager's path. Okay, so from there you move on to become directors and lead on and probably even become CN chief nurse. So that's the administrative path. And the other pathway, if you like clinician, no, Betty, I don't like nurse manager's role, no managing people, but I like clinical roles. Then you can move yourself to become nurse clinicians, senior nurse clinicians, and become APNs for the community. Then the other role, of course, if you say, oh, clinicians not really that, I like to talk to people. I like to train new people. Then you can become educator. So you work into the training pathway where you can go become clinical instructor first, then become NEs, nurse educators, and senior nurse educators, and then you move on from there. So there are many opportunities, but although you hold just one role, there are also opportunities to expand your ability to function outside. For example, you can do innovative work, like innovative nursing, or you can do research in nursing, okay, or improvement in nursing. So it's not just about the career, but the opportunity bandwidth that you can actually work just outside the normal norm of nursing. So that's a lot of career area for you to move on, depending on what you really like and what strike your hearts. Yeah.
Okay, thank you, Dr. Betty. Yeah, it's good to know that there are many different career pathways available, and nurses can actually develop themselves a few years into a career first before deciding what they actually want to go in depth into. Okay, we will move on to the next question. This question is for Yasmin. Why should I join the community care sector? Maybe you can share a bit more.
Okay, so the question I'll ask back is why not join the community care sector, right? Actually, community care sector is an extension of acute healthcare. The sector is growing. You know, I mentioned earlier there's rapid boom. There are many nursing home and community hospitals that are opening, right? So there are definitely many exciting career and development opportunity. I've also shared earlier that it's considered a sunrise industry, right? So if you care about the people around you, take this opportunity to do it as a career, right? Be the person to touch lives of the patient that you care for and their family members. It's a skill that you will learn if you join the community care setting, because you will journey for a very long time with the patient that you care for, right? So I did take also this opportunity, Ren Ci, why not join organization like Ren Ci? We are an organization with multi-services. We have our third nursing home opening in Woodlands, and we also have a full spectrum in the continuum of care, right? So as an organization, we already have a great culture. We have mutual respect and professionalism. We're in fact very close knitted, just like a big family. So we do have supportive leaders and management. So today I have my colleagues here with me. Many of them actually come by together, put this together for the webinar, right? There's plenty of career and development opportunity. As an organization also, we look into fair wages and competitive package for our staff. So, it's a very good place to stay in the sector, the community care sector. And Ren Ci as an organization is one of striving and growing organization.
Okay, thank you, Yasmin. Okay, for our next question, maybe I can get Ka Ying to answer it. How physically demanding is a therapist's job?
So it can be quite physically demanding to be a therapist lah, because really mainly our role is to help our patients to exercise, and do rehabilitation to get better. Yeah, so especially sometimes you do get those patients that are quite tall, okay, quite heavy and quite physically dependent. Okay, then when we need to actually help them to stand, to train them to walk, or to train them to transfer, then that can be quite physically demanding lah. Yeah, however, we do have our therapy aides who can be our extra pair of hands, okay, to help us to assist these patients when required. On top of that, therapists also use a wide variety of equipment such as like ceiling hoists or pet slide or other body weight harness or support systems to help us to better support these patients as well as to offload some of the physical demands of the therapist. But we also will provide training to all our new staff, okay, to make sure that like safe manual handling training, so that they will be equipped with the proper knowledge and the skills so that they know how to safely and effectively, handle these patients. Yeah, so but I think that being said, because it can be quite a physically demanding job, it's very important our own end to stay very fit and very healthy. Yes. Yeah, so that and of course observe proper posture and ergonomics all the time so that we can not only help our patients recover, but also then to prevent injuries to ourselves at work. Yes. Yeah.
Okay, thank you, Ka Ying. Yeah, I think it's important for individuals, especially therapists, to not just take care of the patients, but also in the process ensure their own safety as well, so that they can provide the best recovery as well as best healthcare services for the patients. Okay, moving on, I think we have a member of the audience who would like to know what is the most meaningful thing about the job that you do, and perhaps some of the challenges that you face and how you overcome these challenges. Yeah, maybe Dr. Betty Kong would like to start first. Yeah.
Me, the most memorable
Mm.
experiences that I have in community setting is the
Yeah.
commanding spirit that we have. And not only that, everybody, whoever works in the community setting, have this kind of mindset. I am working for the community, means they lost themselves. It's not about me, it's about us. And most of the time you hear people say teamwork. So it's basically I team you work lah, huh? So that's not teamwork. But here when we talk about teamwork, it's really about teamwork. Means we shed away all our titles and everything. We just do the work. So this is something that I experienced even in Lee Amoy. I see that happening, and not only in just Lee Amoy. The AIC people, the home house people, the nursing home people are all like that. Then you come to Ren Ci side here, we are also like that. When we do mass vaccination, everybody lends their hand, even in the preparation of the sites and everything else. So you see that camaraderie. That's the first thing. And I feel that you have got the sense of kindness, compassion from the people who are in Ren Ci. So that gives me a very long-lasting memory, because most of the time, in other settings, you feel that everybody's just working, work, go home, goodbye, But here we talk about, no, it's not about you alone. It's about us and we. It's not about I and you. So that's a lot of difference. So to me, that's very meaningful as a family. You live together, you sort of work together, and then you try your very best to give off your most that you could. So no one is perfect, so we have to harness on each other's strengths and weaknesses. And that's, I think, is most critical in community care. And that makes a lot of difference.
Okay, Ka Ying, would you like to add on? Perhaps in the therapist role, what is the most meaningful thing that you have encountered?
Yeah, so totally agree with what Sister Betty has mentioned. Yeah, so I think on our end, in fact, I think for most of the therapy side also, it would be really working together with the nurses, doctors, and I think sometimes we do have some patients who have some challenges when they need to discharge and go back home. So it can be in terms of, making sure that the home environment is safe for them to go back, or even making sure that there is a carer and is competent to take care of them when they go home. Sometimes we face these challenges, and it actually takes really the whole team to come by to make discharge safe and a viable option for the patient. So I think the most satisfactory thingy really for us is where we get the patient back to independent or as much as functionally they are able to cope when they go home, and then together with the rest of the team to ensure that the patient can discharge safely. I think that will be the most satisfying thing for us.
Yeah, I agree. And sometimes when you got problem, it's not a problem anymore because it is a problem where we try to solve and address. So together, there's always been a togetherness with all the other multidisciplinary, even the social worker who will come and step in. Yeah, I can do this, and somebody will just raise their hand. Oh, I can help you in this. Perhaps we can do it this way. So that's very reassuring in community care.
Okay, thank you, Kaing and Dr. Betty. Moving on to the next question. Kaing, can you share what are the career prospects for OT and PT in community? And I think Dr. Betty talked about the career pathways for nurses earlier on. Can you share the career pathways for OT and PT as well?
So generally, I think we do have fairly similar tracks to what the nursing have lah. So normally when you first join as a fresh grad, you will start off as a junior therapist, and then as you gain experience and as you work and you have good performance, then you get promoted to a senior and then a principal and so on. Again, also you can have a specialization again depending on where your area of interest is. Yeah, so you can also focus to be a clinician if that's where your interest is. Alternatively, we also have other pathways like you can focus on the training part. If you find that you have more of an aptitude or your interest is in developing, the talents, or to provide training to the younger other staff. Yeah, then we also have a research where you can actually do quality improvement projects, focus on collaborating with other, even like the schools, to conduct researches and trials. Yeah, so and we also have a managerial track, administration track where you can be like, either myself, like you can be a deputy head, or you can be the head of the department, for example. Yeah, so there are again also various career prospects that if you're interested in, depending on your interest, that you can develop.
Okay, thank you, Kaing. So adding on to the question, so it's still related to PT and OT. Can you share, does the PT and OT job in community care differ significantly from the acute setting?
I would say that actually the function fundamental things that we do does not really change, in the sense like physios we are still doing a lot on training the patient, and optimizing their function like walking and stuff, and OT they will also continue with training the patient in the activities of daily living. But I think it's just that in terms of the timeline that the therapist gets to work with in acute hospital is about really making them safe to go home within a very short period of time. So a lot of times it's just doing the essentials, and then the patient gets to go home, or you have to refer them downstream to community hospital like us. Yeah, but on our end, even though we do the same thing, we have a lot longer time to work with our patients, and you can build better rapport, and you can actually help them to really gain that functional independence, make sure that they're ready to go home. So task-wise is quite similar, but actually the timeline and the rapport that you get to do with the patients is actually quite yeah.
Okay. Am I right to also add on that in the community you would have a lot more interaction and can actually journey with the patients and see them really make their recovery process a bit more as compared to the acute hospitals?
Yes,
Yeah.
definitely, yes.
Okay. Yeah. Thank
Any
you.
professional actually will journey a longer time with the
Yeah.
patient first. So the relationship has been developed along the way. So sometimes what I see as a HR professionals, sometimes when the patient and get discharged from our community hospital, they do send thank you notes, to our colleagues, to our nurses, and to our therapists, and then even to the management, thanking us for looking after their moms, their dad, their aunties and uncle. We treat everybody almost like our family members, like our parents, like our elderly. So that's why I think the journey matters a lot. It's the touch point matters a lot.
Okay, thank you, Yasmin. Okay, moving on to the next question. This is for Dr. Betty. What are the key qualities that are essential for a community nurse?
I think the key quality is your heart. If you don't have a heart to serve people, it's very
Mm.
hard to be a nurse, in fact, in the
Yeah.
community. So the heart matters a lot. But I think the other thing is for your ability, you must have the ability to understand that community nursing and acute setting is a little bit different.
Mm.
It's not about you building your own skill sets as a nurse alone, but you have to learn to collaborate with a lot of people outside your scope because you alone as a nurse cannot get the
Mm.
patient or the resident or the client to the optimal level that they could function, not only in terms of function. We're talking about social, their psychosocial, their spiritual, the dignity and the respect that they needed to grow old and, go off in the best wellness that they can and live that. So you need to have that collaborative skills. So for nursing itself, if you look at acute setting, it's like building deep trenches on your ability, skill sets. But in nursing in community, it's about building collaborative. So you build your horizontal skills, where you need to have all these engagement points. So it's not about you knowing how to do palliative alone. In fact, besides palliative, you must know gerontology, you must know geriatric, you
Yeah.
must know dementia, you must know, there's a lot of bandwidth there that you need to anchor and hold on to. So
Mm.
as calmness, this is something that you must be prepared for, besides your heart.
Okay.
But most important is your
Mm.
heart that tells you where you should go. Then you can progress from there. Because what you like most, you tend to excel. And people tend to recognize that as well and support you. See, people are ready to support anybody who tells us where they want to go. Open
Mm.
hand. That's okay.
Okay.
You must have that.
Yeah, I think in the healthcare sector, we are really looking at people with the heart to help patients to journey towards their recovery, as well as the help to help others. And I think not just for nurses, but for all allied health positions as well. We are looking for individuals who display such qualities as well as values such as compassion, empathy, and being able to care for others. Yeah. Okay, moving on to the next question. Okay. Uh, I think we talked about seniors being in a large part of the patients in community care as well as Ren Ci Hospital. Some of the audience would like to know, besides seniors, do you all also take care of like other patients in other demographics or other types of patients in Ren Ci Hospital? Yeah.
We do have, because, of course, most of the
Mm.
common cause in nursing home is the elderlies,
Yeah.
but younger ones as well, because now with
Okay.
chronic disease don't come to only just the senior ones.
Yeah.
The
Mm.
young ones also suffer from it. They may stay longer for therapy in the community hospital, like those who are involved in trauma, accidents. Yes, and they might have lost some ability physically. They
Mm.
also gain those back. So we do have a proportion of them who are younger population, but generally it's the older ones. You are correct. And even in the
Okay. Mm.
all the old ones,
Mm.
because some of the younger patients or residents who could not cope at home, and the family finds it
Mm.
very challenging to take care of them, and they need more supervision. So they are nurse also in the nursing home. So it's not about elderly; it's
Mm.
about the ones as well who need those care. So home care is not about the young or the old. It's about
Okay.
who needs it and where do
Okay.
you go from there and how do we help you to get
Mm.
better. And
Okay.
if possible, near recovery, gain your
Mm.
best possible functional status, cognitive status, emotional status,
Mm.
spiritual status. And that's what we are here for.
Okay, thank you, Becky. Okay, this question, perhaps Yasmin can help to address it. Are there any volunteering or perhaps job shadowing opportunities available at Ren Ci, or because of COVID, currently there are certain restrictions going on? Yeah.
So,
Mm.
yes, we definitely have a lot of volunteering and job shadowing opportunities. But because of COVID, we kind of limit it a little bit because of safe distancing. We
Yeah.
need to make sure we still provide the quality care to our
Mm.
patients. So we really have to maybe put it on hold for a
Mm.
little while,
Mm.
right? Our staff are also going through vaccination. We are one of the nursing home that started with the first vaccination for residents and staff. Yeah, so once, we probably will have to review this again. But for now, we suspend this opportunity
Mm.
for a while. Yeah.
Okay, Yasmin. So, perhaps when the situation is better, if students are interested to, volunteer at Ren Ci or take part in job shadowing at Ren Ci, where can they go to seek such opportunities so that they can keep it in mind when the situation is better? Yeah.
So I think what we can do is students can always write in to us. There's HR email address that they can send to is rinsehr@rinse.org.sg. Right, they can send in their request. Once we are ready to open up the opportunity, what we do is we reach out to the students that have written to us, because we always keep a database of
Mm.
those that have written to us. Right.
Okay. Okay. Thank you, Yasmin. Okay, I think we can take a last question. Okay, so because throughout our 2 weeks of events, we've seen both speakers from acute settings and speakers from community care settings, and I think the audience who they are really interested in healthcare, but certain individuals or certain students are torn between choosing acute healthcare or community care. So, do any of you have any words of advice on how they should make the decision on whether they should pursue a career in acute setting or pursue a career in community care setting? Yeah, maybe Dr. Betty Kong can go first.
So I think the most important question you have to ask yourself, where you really, really like to be.
Mm,
If you like long-term relationship
mm,
with your patients or your residents, then ComCare is the answer for you.
Mm.
Like for me, I used to work in the acute setting, and very, like skill sets. I just want to get this done. These skills I must have. That skill,
Yeah.
yes, chop chop. And then you send your patient off, discharge home. But after that, you don't know what really happened to them. Then they get readmitted again.
mm,
So after a while, you realize, hey, that's not satisfying for me. I like to see someone longer.
Mm.
I like to help them to recover and understand them better. So that's for me in community. So I came out to community in this aspect. And also, if you like challenges, and you know that community hospital, community care itself is a growing industry. It's a blooming flower. Okay, you have not matured yet. So you've got lots of opportunity. Please come.
okay.
Join us. Yeah.
Okay.
So,
Mm,
but if you like something that's chop, fast and quite detached, acute setting is probably the answer for you first to groom your skills. But after a while, you know that in the long run, Singapore is not going acute all the time. They can't be building a lot of acute hospital. Most of the time, will be then moving to the focus will be to com.
Yeah.
Then you will see a lot of people joining community hospital. But be the first group to join this.
Yeah, actually, I think
That's my
so actually quite true, very nicely.
mm,
Nothing to that, you see, because there are many nursing homes that are growing these days, right? And the growth of community hospitals, right? So there's Outram Hospital, there's Sengkang Hospital, then Tan Tock Seng is also coming out with their own community hospital. So actually, the focus is now, like what Betty said, it's going to shift, right? And it's going to be very exciting because there's many opportunities. And if, like, to write on to what Betty said, where your heart calls for you to serve, right? So if you want to touch this person's life and you want to care, you want to make sure that you develop a lasting impression. So you journey together with the family, with the patient that you care for. So of course, then the community setting is going to be more exciting, right? Kain?
Yeah, totally agree with what Sister Betty and Jasmine have said. I think agree lah in a sense like really community is where you get to really spend a lot of time and you build rapport with your patients. Acute is really more of your patients may still be medically unstable. A lot of times the team is just trying to still making sure the patient is stable
To fix
yeah.
the
Yeah,
patient, right?
yeah. So really the things we do is really like just like there and then and to do whatever you but community is really where you help the patient to recover and optimize, get them back to as much as functionally what they can do. Yeah, but I also maybe just add on to what Yasmin has mentioned earlier on about the community services. I think the good thing about it is that, in community care now, especially Ren Ci, we do have a wide variety of services. Yeah, so like you want to journey together with your patients, their care journey. You can from when you are seeing them in community hospital, you can also subsequently even follow them up when you come for your outpatient appointment in the rehab center, and subsequently so on and so forth. Yeah, so I think there's again opportunity whereby if you like to spend a lot of time build rapport with the patients, then again ComCare is where you should go. Yeah, but if again, like Sister Betty, what she said, focus on just honing your skills first, and then seeing that patient, with a high turnover rate at acute, then you can probably go acute first.
I think at the end of the day, it's
Yeah.
not one is better than the other.
Yeah.
Because home care is actually an extension of acute healthcare, but
Yes.
it is the continuum of care that matters. Because, like what Betty said, we want to make sure that the person will grow on in life with more dignity, right, and respect in whatever maximized potential that the individual will have. So it is a long journey. So and that long journey will not just stop when you learn something. So every other day is a new learning opportunity. Yeah, we're all the converted. So
Yeah. Okay.
In fact, I just have got one. I just interviewed a very young nurse who just graduated. So I asked her, and she was not tied to any scholarship, so she's a freelancer after she graduated. I asked her why she had decided to join community hospital, and she said this. And I was a little bit taken aback. She said, when I started off doing nursing course, in fact, I don't really feel that nursing is for me. However, I just want to have a course that I can progress my academics on. So she finished her nursing, and in 3 months' time, she'll be graduating and getting her license from SMB. And she said she decided to join Compost, not Acute, is because of this. Because she saw for herself the difference in allegiance between the different groups that's working.
professional group.
Professional groups, correct. And
Okay.
it differs a lot in the acute setting. And she enjoy those kind of nurturing and camaraderie spirit and genuine relationship. That's why she joined Compost. And she's asking for us. She asked me, how do I think about that?
Yeah.
I said, I respect your decision, and I think you have your observation and make that choice. And of course, I welcome all young nurses to join us as well. While going through the acute and I think she has made her observations. So I want to share with you. You may start off with not feeling like you anywhere, but joining nursing will help you to get to know more about what a nurse is all about and how you can care for not only others, but importantly for yourself and your family. So once you hone that skill, you decide where you go also can.
Okay. Okay, thank you to Dr. Betty Kong, Yasmin, and Ka Ing. I do think that community there are a lot more opportunities to go along the journey with the patients, and there's a lot of camaraderie between the allied health as well as the nursing and even the corporate staff within the community care as well in Ren Ci Hospital. So before we end off the session, Yasmin, would you like to have a few words to share? Yeah.
Sure, thanks. Thank you so much. Okay, I think we would like to thank the viewers for watching into our webinar. We hope that we've given you very informative information about the community care and also about our organization, Ren Ci Hospital. Follow us on Instagram, on our Facebook, and check us out on our website, www.renci.org.sg. Okay, so if you like what you see and you want to know a little bit more, do drop us a note. All right, we'll be very happy to answer to your requests or your queries, right? We hope to welcome you on board as part of Ren Ci family members. Thanks all.
Okay, thank you, Yasmin, and thank you, Dr. Betty Kong and Ka Ing, as well as the speakers who joined us earlier in this session. And I hope the audience has benefited from their insightful sharing. So we have come to the end of this session. If you have enjoyed today's program, please take a few seconds to rate it at the bottom left of your screen. Okay, our next session is Make a Difference in Community Care, Center-Based Care with NTUC Health. It's happening tomorrow at 10:30 a.m. NTUC Health will be sharing insights into center-based care delivery for seniors and around meaningful opportunities in one of the largest and leading elder care providers in Singapore. We look forward to seeing you at our next session. Go on and have fun as you learn to dare to care in our online webinars and virtual activities. Thank you once again. Have a good afternoon. Yeah.